Well, the first time it's very overwhelming because you don't know exactly what to expect. It actually is very stressful on the patient and or the family or caregiver.
It's a scary journey to go through. You don't know the environment, you don't know the people.
It feels that way every single time I walk in the door with him. I've carried a limp child into the ER and handed him over to people and watched them walk away with him before. And that's scary.
As I started to do some research, I thought, wow, I think this would be, something that would be really helpful for the hospital, an opportunity for us to actually hear what patients have to say about the work that we do.
You have those boards in there, and you can put that on the board. It would help.
We have 6 hospital committees that have patients sitting on those committees giving feedback. We have patients who are invited to physician meetings to talk about their experiences. We've really given the patients a lot of different platforms to be able to really hear their voice.
I think it's important to give some of the nurses and doctors ideas of how to more connect with their patients. There's amazing doctors and nurses that's here, but there's always work to be done.
When they talk to you, they usually talk to you in medical terms. And I understand that this is a medical facility. As a patient or a caregiver, you have no idea half the time what they're saying. One of the things that I like about this, the PFAC committee, is that you actually do get to say what you want. You can talk, you can explain your view.
I wanted to encourage and support the mission of the hospital, to provide feedback from a parent, and especially one that is here as often as I am, and to be able to say, that's really great, but let's try it this way, or let me give you my perspective from where I'm sitting, and maybe that will help some future parent who's going to be sitting in the same spot.
When you ask me, does VCU listen? Yes, they do. They're listening now more so than they ever have. If I notice something or say something, it seems to have an effect.
When we first started, this building was still in the process of being built. We were able to walk through and say, oh, that's amazing, or, oh, we need to look into that, we need to fix that. And there were a few things that did get fixed based on our walkthrough before the building opened up, which is wonderful.
When I come to the meetings, I can take what my experiences from when I've been in the hospital and share those and maybe implement those in any type of issues or topics or ideas.
So I can communicate with Selena and she will bring it up or bring the topic up for discussion at the next meeting, or bring in people that are involved in that, and they come right out and say, yeah, we'll take that under advisement or we'll work on that.
So having that voice and having something to do that can help not yourself but also others is important emotionally, mentally, and that has really, I hate to get emotional, but that has really helped me give myself drive, to get through to some of the things that I'm going through.
It's an interesting feeling to feel like you have some say in a health system that's this big. We're very small fish, but we're making small changes, and I feel like overall those small changes affect the health system in general in a positive way, and that's a wonderful feeling.